Regarding one of the other drugs that we have for the treatment of myeloma is the acetylase inhibitors. In fact, these were the third mechanism of action to be approved in the recent years in this century, but unfortunately they have not been used and widely used for the treatment of multiple myeloma by doctors. Why? Because they demonstrated activity, which was a marginal activity in a subset of patients with multiple myeloma with more than 2 prior lines of therapy and PI and LEN exposed, but the tolerability was not very good, and that had resulted in they are not widely used in multiple myeloma. But I think they may still have a role in this setting. Now that we have so many agents that we are now having the immunotherapeutic activities that are moving to the early lines of therapy, probably there would be a niche for using this type of drugs, maybe in combination with bortezomib or with other combinations that could potentiate the activity. And here I'm thinking also in the immunotherapy, maybe these acetylase inhibitors could potentiate the activity of the immunotherapeutic agents. Maybe we could select patients that could be more sensitive to these deacetylase inhibitors, and even we could try to find a novel, more selective deacetylase inhibitor or better combinations or better schedules of treatment that could make them more tolerable. I know it's difficult because they are not being used, but I think still may have we may find a role for this or a niche for these patients, for these drugs for our multiple myeloma patients.